So we're going to turn to our panelists now. And I think just to keep this a little simpler, why don't we just start, Dawn, are you okay to go first? And we can just work our way back in this direction. Yes, please come over.
Bonjour. My name is Don Ensign. I work from David Child's Service, and I work there as a immense treatment worker at the present. I've been there now for 11 years.
We're just going to turn the volume up.
Oh, sure.
Where's that?
Okay, can you hear me? Hello? Okay. Let's try this. Turn it on. Okay. Just stand close here. Sure. Okay. Just stand right here. So I work with mostly Indigenous men. I come to the agency. I facilitate a program called In Search of the Peace Aware program. And one of the main focuses of the program is to help the men to express their emotions. And I'm going to talk about a terminology. It's a clinical term, but basically what it means, the word is alexithymia. And basically what that means is it's a lack of emotional vocabulary. So I start off them off with the 5 basic emotions of mad, sad, glad, scared, and confused. And one of the things I've noticed over the years I've been working with the men, especially with the First Nations men, is that we focus so much on expressing our emotions using English. And English is not our first language. Our first language is our first language, like all the languages there across the land. So what I've been doing is, and I've been doing this on my own, and just starting to go more into this direction, is indigenizing the emotional words. For instance, when we say angry in Ojibwe, we say Gidaza, which means he is angry. And the reason I'm going in this direction with expressing these emotions in my language is because it touches my spirit. I'm putting spirit into those words. And when I speak English, most of the time it goes to my head. When I speak, because I've been, I was for the first 7 years of my life, I spoke, all I spoke was Ojibwe for the first 7 years. After 7 years, I was forced. I went to school, but I was not allowed to speak my language when I went to school. It was instantly suppressed. But I was able to, go back home. I attended the Indian Day School in reserve. So when I go home after full day in school, I would go back to speaking my language again. And of course, I knew what my parents were talking about. But at that point in my life, if you talk to me about expressing my emotions in English, I don't think I could have understood you at that time. I understand you today, but still, it doesn't give any depth to the emotions that I feel, especially when I say them in my own language, because I know, because this is where I'm coming from. I think. There was a slogan one time that was way back in, I think it was the 60s or 70s. The slogan was "Think Indian," and that's what I try to do with the men that come to the program. And we also have another. When we say suicide in our say my language, it was expressed in the way we say it as a "ginsitza," which means he killed himself. And another one is a "winsinza." It has to do with spirit. We kill our spirits before we kill our bodies, and that's So basically, that's what I've been trying to do this last 10 years now with the program is, is actually, indigenizing the program. I want to get away from and because I look at the language itself as I'm not trying, I hope you don't find this word offensive, but it's the down society's language. And for us, it's the oppressor's language. So why we want, and I ask myself a lot of times, why do we as a people want to speak the oppressor's language? What we need to do is empower our own language so that we can empower ourselves again. Not only emotionally, but spiritually, physically, and psychologically. So this is the direction I'm hoping I can move this program toward to in the next little while. And when I do work with the men one-on-one, it's the same thing I try to do. I try to get them, in that direction again. So I want to thank you for hearing me. Chumilach.
Okay, we're going to have, why don't you come up? So, some background, Eleanor Levine, psychiatric social worker from University of Toronto, please.
I work at the University of Toronto in the Faculty of Social Work with master's degree students. I have a private practice and I see mainly women. And I go to the men's center and I see only men. And people are often surprised when I see men. I think the men are sometimes surprised too. Will they speak to you? After all, you're a woman. You're the enemy. And the way I describe it is often before their bums actually touch the chair, they're already speaking to me. Because they see that I'm not judging them, that I will believe them. And often when I see one person, that person wants to continue to return because they're validated. My point is that we're all social animals and we all have similar needs. And I think men and women are more similar than different from each other. When I tell people I work at the men's center, they say, oh, anger management? That's the immediate assumption. When I listen to language talking about men and women, somebody here earlier said oppressors and the oppressed. Another one that the media uses and that a lot of other people use is the victim and the perpetrator. Of course, we know who the victim is, we know who the perpetrator is. In my private practice, there's a woman that I see. She's quiet, soft-spoken, well-educated, and she has a major problem with violence. And she talks to me about it, but our society doesn't want to hear about that. So I feel really privileged to be able to work at the Men's Center. I respect the people I see. I respect the other people who volunteer at the center. And I would like to see, I appreciate what the Ryerson students are doing, and I'd like to see more respect and more appreciation. And I want to add that, just one more piece of stereotyping. Supposedly, women are more nurturing. They carry the babies, they give the babies milk when the babies are young. I don't believe that for a minute. I think that men are every bit as nurturing. Thank you.
Well, that leads nicely to Jason, who joins us from a really remarkable organization called Young and Potential Fathers. I was so glad to learn about your agency just over a year ago and to come out to some of your events.
Thanks so much. I'm going to preface this by saying that I did not expect to be at this particular podium. I was more than comfortable to be sitting there and taking in the series with all of you. But at the same time, I'm grateful for this opportunity. As Justin had mentioned, my name is Jason Johnson, and I'm the program coordinator for Young and Potential Fathers. We are a nonprofit organization that operates in the west end of the city that our main focus is providing support for men and families, or primarily for young men and families. We are one of the legacy agencies that had actually originated from the Youth Challenge Fund that was provided by the United Way in response towards the Summer of the Gun, the Jane Creba incidents that had taken place, in order to identify the social determinants that actually caused such actions to take place, and at the same time being able to actually address a number of the barriers that men, and especially racialized men, had actually faced to make those tough choices, whether it be systemic, whether it be family challenges, whether it be societal norms, for example. And out of that particular fund came the Younger Potential Fathers Initiative, which had turned into a nonprofit organization. We run a space at the corner of Weston Road and Lawrence Avenue West called Ujima House, which we're proud to say is the first and only father-focused family resource center of its kind in Canada. That's a big statement because of the fact that in a lot of cases you would end up having prominent spaces like Ontario Early Years Centers, for example, and other family resource centers that come around, but the majority of the demographic that usually receives that support is usually through young women and mothers. In a lot of cases, when a father would go inside their space with their child, regardless of what the circumstance is, there would be a lot of talk about a microscope being felt upon them over the way that they are interacting with their children, as to whether or not that they were actually mandated in order to provide that support from their child. It's not normalized to be able to have that concept of an involved father, and that's what our organization is doing our best to be able to change that stigma with regards to, and also making sure that understanding that involved fathering and involved fatherhood is being seen as a societal norm. Within our space, within Ujima House, we actually conduct parenting programs on a weekly basis, whether directly run by us or in partnership with other prominent organizations such as the Children's Aid Society of Toronto, Toronto Public Health as well. At the same time, we also run family access programs within the space, which allows for the ability for men and their families to be able to come in and conduct either supervised access or community access, just to be able to learn and be able to apply what they've been able to learn within the parenting programs that they would conduct. We also do one-on-one mentoring with the fathers that come inside our space as well, to be able to talk about the issues that they face inside a safe and non-judgmental way. Ultimately, we want to make sure that there is culturally sensitive support. We talked about the challenges of how we've heard from our speaker before around First Nations. We've talked about the issues, especially with regards to when it comes to racialized fathers, and being able to see that there are those particular challenges. And ironically, as a former student of Ryerson University, it really actually hit home to actually see the challenges that current students are facing when it comes to being presented with a men's group, being able to actually facilitate a men's group on campus, which is very troubling to say the least. When there's all of this talk about equality and equity within these particular spaces, and not having that ability to be able to make sure that the support that men need is actually made available. Now, I know for a fact we'll be able to go further into that within the panel, but I just wanted to make sure that that was stressed, that there is that need. And the same way as how Dr. Whitley had actually talked about that action-based support, that's really where we as an organization have been able to really see a lot of the successes and a lot of the barriers being overcome by the men that we support, to make sure that there's shared experiences and it's not a top-down approach that is being presented. We want to make sure that we are collecting shared experiences from fathers from different walks of life to be able to find solutions to the challenges that they've been facing. And ultimately make sure that there's a generational impact that's addressed as well, to make sure that those more experienced men are able to provide their level of expertise towards younger men that are just becoming fathers or trying to really understand their place in the world ultimately. And really, the best way I'd be able to sum it up is, in order for us to make sure that there is going to be that level of support that men need, it has to be starting from the beginning. It has to start as early as possible. And just the same way as how we want to make sure that there is that generational impact, we want to make sure that those levels of support are available on all aspects. And it's not a matter of how was actually alluded to before. It's not a matter of ostracizing one group from another. It's a matter of actually taking the strengths of the various groups and finding the best supports that would be available. So hopefully dialogues like this can actually take place in order to reach those solutions that we need, and we continue to stay open to alternative ways to make sure that the men that we are looking out for are supported in the best way possible. So thank you so much for listening, and I hope to connect with you.
As I said, he impresses me. Your organization is really remarkable. Alexandra Perry, who joins us from Partners for Planning. We're going to hear a little bit about that.
Thank you guys so much. I'm just like Jason, I wasn't totally prepared to be speaking to such a lovely, large audience, but thank you so much for the invitation. So I'm coming at this from a role of an independent facilitator. The Ministry of Community and Social Services is currently completing a research project for adults with a dual diagnosis. So that's a mental illness and a developmental disability, very sort of complex situations. And during the project, I've been working with the focus people for the last 15 months. And a lot of the men that I've been working with are obviously very, very interesting and fascinating people, but have really taught me how we've made a very big mistake when it comes to men, mental health, and developmental disabilities. I think there's been an assumption that men with a disability don't actually really deserve to have mental health services or gender services or sexuality services. So in this sort of passionate disagreement with this, I reached out to Justin and the CCMF, and he kindly welcomed me into the office, and we had a really exciting conversation about this being a very big need in the community. And since then I've been working with the ministry and trying to find some ways that we can close the gap. I found out today that there's a new project happening for homelessness, and that after surveying 170 homeless people in Toronto, 50% of them identified with having a developmental disability. So there's something we're really missing here. I think the second thing I wanted to bring up was just in light of the two gentlemen that brought up some long-term supports when it comes to addiction. So just to explain the role of facilitation a little bit more, essentially it's helping an individual create their own community by using the community. So using natural supports and inclusive opportunities, and pushing people to kind of look at things a little bit differently, focus on skill and ability and interests and stuff like that. When I first learned about this with my postgrad in addictions, I immediately thought that they should be doing another project and testing or researching the role of facilitation for people who are either struggling with an addiction or coming out of recovery. So I would love to see if you guys had any feedback in regards to that, if that would be a helpful role or something that you would be interested in on a long-term basis. Facilitation is a very passive role and focused on the person directing it. So I think that would be a lovely conversation to hear from you guys as well. But this is really exciting. I think it's a great thing that we have such a large room with so many different professionals and people coming from all walks of life. So thanks again for having me.
Thank you, Alexandra. Next up, we have Huma Shireen, who is I think, former mental health counselor with the Ministry of Community Safety and Correctional Services, and now works with CAMH and does volunteering with our agency. As does Eleanor, by the way. Both Eleanor and Huma are counselors at the CCMF. Please.
Thank you. Hello, everyone. I have to start off by saying it's absolutely wonderful to see so many smiling faces, nodding faces supporting this cause, and I'm really happy to be here. I'm going to start off by first of all saying thank you to Justin for having me be a part of the center. I've been there only since October, but it has been one of the most enriching and also one of the most challenging parts of my career. So right now I have a caseload of 2 clients, and they've both asked for longer term counseling, and both of them have the goal to be able to forget kind of what has happened with their ex-wives. But what I notice in my time with them is that in seeking out the support, that in the way that they do, and in many other instances in my time with them, I just notice kind of their incredible resilience and also their self-love, in that they're not going to stop right now. They've been through a difficult past and they want to seek out the support, and they want to, they realize that this is not it for them. There is something more out there for them, and they're constantly seeking it out. And I'm so happy to be a part of that. These men have been through a lot. They've been through trauma, they've been through loss. They've trusted, and they've been let down by someone that they've trusted dearly. Again, they want to learn. They just want to know themselves and their places in the world. And again, I'm so glad that a place like our center exists to provide them with that help. In my experience at CAMH, I worked there full time, and I was fortunate enough to be a part of the women's unit there for a little bit and do a little bit of work there. And I've seen it there as well, how kind of a rotating door system gets formed. The program there is incredible. People come in when they need help in the most dire times of their life, when they're suicidal, either they've hurt themselves or they feel like they want to hurt someone else, and they come in and they get the support, and they stay for a short period of time and they end up leaving. And that's kind of when the real work needs to begin, like one of our members here said. But that is also where the support tends to be lacking. So they come in, get the support, and leave, and then they don't know what to do. And that is exactly when the deepest exploration needs to begin. And that is exactly what I'm here to kind of advocate for. At the center, we have other counselors who are there to offer their time to these people to kind of go into that exploration. And I just hope. Ideally, psychiatrists would be able to do more counseling, do more psychotherapy. Ideally, psychologists would be covered by healthcare and be able to provide their time. And long-term therapy, that in-depth exploration of who we are, what makes us who we are, beyond the addictions, beyond the violence, what is at the root of this cause, is getting addressed. Ideally, that would be happening. And I just hope that kind of time comes where you don't have just a Band-Aid solution, and people can take the space and the time to get what they need. And again, I'm so happy to be a part of that work at the center and hope to see more of that in the future. Thank you.
Thank you very much, Huma. We're going to move along now. We've got a few more distinguished guests. We have Mahyar Mohammadzadeh. Did I get that? Oh, good. I was practicing earlier. He is a men's program clinician with Family Services of Peel. So glad you joined us from Peel. Please.
Hello everyone. My name is Mahyar and I'm the Family Services of Peel Male Survivors of Sexual Abuse Program clinician. Working with men at Family Services of Peel has been one of the most rewarding experiences in my career. It has opened my eyes, allowing me to see more deeply beyond human suffering. Through this lens, I have witnessed the gentleness and kindness of these male survivors. Men who, because of traumatic experiences, social pressure, and unfound stereotypes, are forced to act tough and manly, or isolate themselves from life, ignoring the most important treasure that all of us share, which is self. For me, what makes the male survivors seeking help stand out is their sheer resilience, their will to survive, and to rise above their traumas. Given similar circumstances, I don't know if I would be as strong as they have been. If you were to walk into one of the male survivors of sexual abuse groups, you would see a kind smile on their faces, joking and laughing with you and welcoming you to the group with a warm attitude and respect. Through no fault of their own, the men in our program have experienced unspeakable trauma, abandonment, neglect, and abuse from an early age, often by members of their own families. Our program provides support through individual and group counseling, peer-to-peer counseling, e-counseling, and telephone counseling. We support men who have experienced childhood sexual abuse rebuild their lives and break the intergenerational cycle of abuse and neglect. The program emphasizes personal empowerment and helping clients to become agents of social change, both within their families and the community at large. All of this is done in a safe, free of judgment and expectation. I've learned from my experience in the men's program and from previous experiences working with marginalized and traumatized young women that resistance to change is most often the primary barrier to therapeutic insight and progress. We all know that overcoming our fears and creating change is not an easy task. I have had the opportunity to witness the men's achievements and success in conquering their fears and working towards personal change and empowerment. I am confident that with increased collaboration and sharing of experiences, we will be able to create a better world for our children and future generations. Thank you.
Thank you so much for your important work. We're going to call up Philip Dufresne, who is a board member with Houselink Community Homes, I think is the full name, and that is an organization that is concerned with homelessness, affordable housing, poverty, and mental health, so the intersection of some really critical issues. Philip?
Okay, thank you, Justin. I'm also a tenant there in Houselink, and most of my life I never really knew what I wanted to do for a living, and I was kind of a loner. I never fit in anywhere, and I graduated from university in Montreal at Concordia University with a BA in anthropology. Then I moved to Toronto to look for work. But I had difficulty finding jobs. I did a few minimum wage unskilled labor jobs for a while because I figured they were better than nothing, but they just frustrated me. So I ended up quitting my last job, and I couldn't really find anything else. And then I got evicted from my apartment, and I ended up on the street at the Salvation Army hostel at Queen and Sherbourne. And I began to realize it wasn't just enough for me to find a place to live. I had to find a way to change the system because no human being should ever have to face poverty and homelessness. So I met a social worker there at the Salvation Army who helped me to get into supportive housing at Houselink Community Homes. And I decided that I would do some volunteer work there. And I found out that's what I really wanted to do in my life. I never had any interest in any of the paid jobs I ever had, but I liked doing volunteer work because I'm interested in solving social problems, and I'm interested in getting rid of poverty and homelessness. So I think supportive housing is exactly what I needed. And so I did. I still live there in Houselink. I've been there for 25 years, and I've worked on several different boards and several different community groups, you know, fighting poverty and homelessness and mental health issues. And I think that it's really important that we stress the need for more affordable and supportive housing. Affordable housing is the most important thing in your life. If you don't have an affordable place to live, you can't do anything. You can't get a job, you can't go to school, you can't take care of your health, you can't raise a family, you can't do anything with your life. So everywhere I go, I tell people we need more affordable and more supportive housing. And when you go out and vote, make sure you vote for politicians that push affordable and supportive housing, because housing's getting more and more expensive and poverty and homelessness are increasing, and the politicians have to put this as a priority on their agenda, and you have to keep pushing it. Houselink, they do a lot of things for us. They have a social rec program there, you know, where people can get involved in free social rec activities. They have a bursary fund if people want to go to school. People can work on the board there, and they have a say in how their housing and programs are being run. So supportive housing for me is the answer, and it's the answer for a lot of people who have experienced poverty and homelessness and mental health issues. So thanks for listening to me.
Thank you, Philip. It almost sounded like you were running for office. Maybe if nobody else steps up, you can take that on. So last but not least, we have Alex Trottier, who has a master's in counseling psychology and has done a stint as a practicum student with the CMHA.
So I think I'll probably echo a lot of things that have been said already. So I'm a recent graduate. I'm new to the field of mental health, but I've noticed a few patterns already. So I first got involved in mental health after losing a friend, so I have that personal connection to it. This was about 6 years ago. A close friend of mine, he was sort of the life of the party, the soul of our group, and he completed suicide, and it was a shock to all of us. It was sort of the story you've heard before, you know, just the nicest guy, very creative, passionate, and came out of nowhere. And as far as we knew, he hadn't shared his story really with anyone, and really we found out that he sought services a little too late. So I decided to pursue psychology after that. And once I did that, I found even more close male friends stepping forward and telling me their stories. And the story repeated itself. Suicide attempts, thoughts of suicidal ideation, and just this kept coming up. Then I pursued my master's in psych, and as Justin mentioned, I just did my practicum placement with the Canadian Mental Health Association. And although most of my clients were female, I did have a few male clients, and once again, those patterns just continued. Either seeking services too late, in that they had already attempted suicide. Luckily they were there, seeking and getting the support that they needed at that time. But I just kept hearing the same story, just feeling really invalidated, belittled, kind of pushed aside. And really they were experiencing some of the same things that the female clients talked about. So anxiety, depression, low self-esteem, low self-compassion, as I said, suicide attempts or thoughts of suicide, and sexual harassment. And the difference was that with the female clients, their stories were heard, they were trusted by police, whereas the male clients, it was a completely different story. They had the same experience, but again, just felt belittled and not validated, which was really key. Once they stepped into my office, I at least offered that form of support of validating their story and trusting them and believing them, and that really helped build our rapport, and they could continue to seek those services. So having lost my friend and having met with a few male youth, I do think that now is the time to have a center on campus for men needing services, designed by men. Having them involved in that conversation is so key. The male clients I did speak with told me that what they really enjoyed and appreciated about our services was that they could use our group therapy. And in those groups, they met women as well, but also sharing their stories with like-minded men who had similar experiences and a similar narrative, and the opportunity for that rapport and back and forth and building and sharing those stories. So I do think now is the time to have these services available for men, and if maybe they were available 6 years ago, maybe my friend would still be here. So thank you for having me, Justin.
Thank you, Alex, and thank you for sharing that very touching story. So that's the panel, and I just want to say, well, first of all, thank you to the panel. I should say that first. Thank you very much. I also want to say that, as you heard from Sarah and Catherine, we've had some challenges at Ryerson. You may or may not know all of the details, but you got some of the backstory there from those two students. But look, if with this caliber of panel and all of you here tonight, if we can't, crack this nut, then I don't think there is a solution. So what we're going to try to do is to brainstorm some ways to move forward. One way is certainly to try again. I think this would be certainly the holy grail for us, is to have a men's issues group which could serve as a men's health space, as a support space where men and women, by the way, this has always been an initiative that brings all the genders together, but with a focus and a dedication to the needs, problems, and challenges that are more prevalent among male students here at Ryerson. That's one approach, but I'm sure that there are other ways that we could do this. But the idea is really to provide that safe infrastructure where we can address these, in some cases, as you've heard from Alex, life and death issues.